Now let's take a moment to explore the idea of occupational therapy. Now, by definition, occupational therapy is therapy that's based on engagement in meaningful activities of daily life, things like self-care skills, education, work, or social interaction, especially to enable or to encourage participation in those kinds of activities despite impairments or despite limitations in physical or mental functioning. As you can imagine, occupational therapists work with some of the very same conditions that physical therapists do. Probably because of this and because of the similarity of their work, many people think of occupational therapy and physical therapy as being the same thing. And while there certainly is some overlap in the scope and practice for the two, and they certainly are very complementary, there are also some distinctions and differences. For one, where physical therapy focuses on regaining or improving physical movement, occupational therapy focuses instead on improving the ability to perform everyday tasks. Now, since many, if not most, everyday tasks include movement, you can see where there is some overlap in the scope and practice. But again, the key is that for occupational therapy, the focus is on the activities of daily life, or as occupational therapists call them, ADLs. In our pictures here, you can see some really good examples illustrating occupational therapists working on ADLs with children. We see a therapist assisting a patient in navigating with a wheelchair, helping a child with handwriting or eating, learning to navigate play objects and toys. Now, those activities are very concrete when it comes to thinking about everyday life or ADLs, but some work done by occupational therapists is less obvious in its connection to daily life, and yet is still so very important. Let me give you an example. Occupational therapists also work with children who have sensory processing issues. They work to design activities for these children that improve their ability to actually process information they receive from their five senses. Now, while this work is less obviously task-oriented, like our earlier pictures were, it is still very impacting in terms of how a child functions in activities of daily life. Because when we have poor sensory processing skills, it can make everyday activities very difficult and even stressful and uncomfortable. What we know is that improving a child's sensory processing skills actually improves their experiences in those daily activities. So, it's also important to note that many children that have spent time in less than optimal care at the beginning of their life struggle to process sensory information correctly, and so they do benefit from the services of an occupational therapist, even if they have no other special needs per se. Besides working with sensory processing issues, occupational therapists also focus on things like feeding issues, development of gross motor skills, age-appropriate self-care skills, development of communication skills, appropriate social interactions, language and cognitive skills, and self-concept.